Hi there, this is Dr. Ginny Bender from Glidewell. For aesthetic veneer cases, there are many steps that lead up to the finish line. The cementation of veneers is probably one of the scariest things we do as a cosmetic dentist. A lot can go wrong, so let's go through the protocol and learn how to avoid common problems. This is a 62-year-old male patient who wanted a smile makeover. For teeth number 4 through 13, I chose BruxZir Aesthetic Zirconia Veneers for its beauty and strength. This product has high flexural strength at around 870 megapascals with more translucency and enhanced optical light transmission. After checking clinically the fit, shade, and contours, always get the patient's approval, verbal and written, prior to permanent cementation of your veneers. Bonding zirconia can be confusing for some, so let's find out what is zirconia and what is the bonding protocol. Zirconia crowns are made of zirconium dioxide stabilized by yttria. If there are salivary contaminants in the intaglio inner surface of the restoration, the bonding process is compromised. If any steps in this process is not followed, the restoration will not optimally bond to the cement or the tooth, meaning your veneers will fall off in a short period of time. When you receive your BruxZir Aesthetic veneers back from Glidewell, they are already sandblasted in the intaglio surface to create microporosities that enhance micromechanical retention of the cement to the restoration. After intraoral try-in, the salivary phosphate contaminants must be removed by either chairside air particle abrasion or a dedicated zirconia cleaning agent like Ivoclean. When using Ivoclean, first shake the bottle before use. Cover the intaglio with a layer of Ivoclean. Allow 20 seconds for the cleaning action to take effect by scrubbing it in with a clean microbrush. Then thoroughly rinse with water spray and dry. Next, prime the bonding surface with your favorite zirconia bonding agent, like 3M ScotchBond Universal Adhesive. This contains the key ingredient 10-methacryl loyloxy decyl dihydrogen phosphate, also known as MDP. So for the veneer, apply ScotchBond Universal Adhesive to the inner veneer surface. Gently air dry for 5 seconds to evaporate the solvent and do not light cure. For the tooth preparation, apply 35% phosphoric acid edge to the enamel and dentin for 15 seconds. Rinse thoroughly with water for 10 seconds and dry without desiccating the dentin. Desensitize dentinal tubules with Gluma and be careful not to get it onto the soft tissue as it can be an irritant. Suction off the excess and wait for the gloss to disappear. Typically, I wait 60 seconds. Apply ScotchBond Universal Adhesive immediately to the entire surface of the enamel and dentin and scrub it in for 20 seconds. Gently air dry the adhesive for approximately 5 seconds to evaporate the solvent. Do not light cure. For all veneers, the best choice for resin cement is one that is light cured because we will have full control in light activating the polymerization process. For this case, I'm using NX3 Nexus Light Cure Resin Cement by Kerr. The worst case scenario in using a dual cure cement is that we race against time for that cement cleanup. I typically deliver my veneers at the same time. I start with number 8 and 9 first, then the others are seated in sequence. Seat each veneer loaded with cement using gentle pressure on the facial and incisal with 2 wood sticks. I always like to see the cement squish. If it doesn't happen, I don't feel good. If you know, you know. The secret to a good seal is to have the cement squish that fills the cement gap that exists with all indirect restorations. Plus, it's easier to remove it in one chunk. Use a curing light with a small diameter and a focused tip to tack cure the center of the facial, and that way you get the cement in that gel-like state. Gently remove gross excess cement away from the margin with a blunt scaler. For the interproximal areas, I use Knotted Floss by Glide. The nightmare that we all fear is when cement sets into the embrasure undercuts. It's very difficult to remove. Always, and I mean always, have a serrated saw strip ready, as it is the ultimate solution for interproximal removal of unwanted cement. After all residual cement has been removed, light cure the gingival edges for 30 seconds, followed by the middle and incisal edges again for 30 seconds. Recheck flossability and the bite with your articulating paper. Make final occlusal adjustments using the BruxZir Adjustment and Polishing Kit. The football fine grit diamond burr is used with lots of water, and it's great for adjusting the lingual aspects of anterior teeth. The green cup, brown wheel, and white cups are next used to create smooth surface that will be kind to the opposing dentition. The final polish is with Profu paste to make sure that the patient leaves with a nice, smooth feeling so that they feel brand new. My patient loved his new smile. His self-confidence has improved greatly, and he's able to laugh without covering his teeth now. Stay tuned for more educational videos from Glidewell.